Hello, this is Angie DeRosa, Senior Editor of Contemporary OBGYN, and thanks for watching today. Dr. Linda Fan is an Associate Professor and Director of the Division of Gynecologic Specialties in the Department of Obstetrics, Gynecology, and Reproductive Medicine at Yale School of Medicine. Dr. Fan, along with several co-authors, wrote a piece in the September issue of Contemporary OBGYN addressing how to manage the well woman visit via telehealth. As a follow-up to that, Dr. Fan is here with us to discuss the role of telehealth and how it has expanded as the pandemic heads into its second stage. The pandemic has forced healthcare to adapt, and visits such as the well woman visits can be offered via telehealth as a safe approach to timely care. As Dr. Fan and her co-authors wrote in the September article, during this pandemic, the collaboration of insurance carriers, physicians, healthcare systems, and use of technology have allowed for accelerated uptake of telehealth. These innovations have been leveraged to respond to the changing needs of patients in an unpredictable landscape. Listen to Dr. Fan's insight on how it's changed, what it means for patient care, and follow us online at contemporaryobgyn.net for more coverage of telehealth. Thank you. Given the uncertain duration of this pandemic, the need to advocate for routine women's health care in a patient-centered manner is essential, as you all had pointed out in that article. So can you talk briefly from your perspective too about that and why that is so important? And are there concerns that women may forego routine care given the nature of the pandemic?
Yes, I mean, I think that this is such a relevant and timely question right now as we're all facing a second wave and some lockdowns, some, in some areas, just stronger wording on restrictions. I mean, just to take it back to pre-COVID, I think that women as primary caregivers tend to put their needs secondary to their family. They may be taking care of ailing parents. I've just seen that they often present later. They just put their needs secondary. What we are seeing now as there are economic changes, it's a whole shifting landscape where they may have insurance shifts. And then, adding on to that, you have things like social distancing, and they have uncertainty of whether the doctors actually want to see them, which we do, but I think that there's like there can be misunderstanding about that. And then then like an additional level, you add on the difficulties of homeschooling, that, they are then the time that they normally have to go see their doctors is gone. And then, I mean, those are sort of the barriers that we're facing, that are mounting in this time period, and, trying to figure out how to reach these patients. And then, things that are very COVID specific about why we don't want patients to delay. I mean, there are specific concerns about, routine screening that they're delaying, but then also in economic downturns, we also see increase of domestic violence. And the ability to assess risk for things like that, intimate partner violence. We lose those opportunities when the patients don't come in.
And there have been reports about that escalating because of the pressure that people are under with the economic pressures, with the being in more closed quarters with family members when we're in lockdown.
Yeah, certainly. I think that these are all concerns.
Can you quantify how many patients that you have seen, or that others, as you were talking about with other providers, for conducting the well woman virtual visits?
Yeah, in our hospital system, there are some clinics who have really run away with these virtual telehealth visits or well woman visits. We have, some practices that a lot of the annual care is done by advanced practice providers, and they see up to a third of their patients as well women, as a virtual well woman visit, which I think is an incredible feat.
That is. And what about the patient response to it?
I would say that it's interesting. I mean, at first we had fear that patients would find it to be intrusive into their home. But I will say that people are used to FaceTime. They're used to Zoom. It's like a technology that that is very well. I mean, it's just accepted now, and so that technology part of it is not a problem as I thought it was going to be. And then the other thing that I think a lot of people fear that you lose that connection with the patient. But I see patients both in person and on telehealth, and I do find that I actually really and the patients really enjoy being maskless. They feel they're in the ease of their own home. You can see the face of your doctor without and that itself, I think, puts people at ease. Mm-hmm. And then sometimes if I see them as telehealth first, and then I bring them in, they're all extremely, they all express that they're glad to have seen me in that, in a virtual telehealth way on video, so they could see my face, see my personality, and so that's been really like a surprise to me. Okay. And then the other part is the sheer convenience of telehealth, where the patients don't need childcare to see their doctors, and they don't need to take off work. I mean, I've had patients actually, they're thrilled that they can just say, oh, I'm on my lunch break. I took a break. I'm going to, check in with you, get my lab results. Or they can even get their virtual telehealth visit in this way.
Now, have you seen, rescheduling or cancellations that such visits can be prone to? What have you seen or experienced?
Sorry, go ahead. I'm finished.
No, firsthand with that behavior, has that posed any problem?
I will say that in general, patients see their routine screening as non-urgent, and like to get their routine GYN exam. If there is any adverse condition, so really rainy days, too cold days, we'll definitely see more patients drop off. I actually can't quantify how many patients do, have not even made appointments because of the COVID restrictions or, other issues with the pandemic. But this is, the visits at the height of COVID, the visits definitely drop off, because of all the restrictions. So
now the tricky area, of course, insurance reimbursements. Has that been an issue?
It has not been an issue. I think that there are, as I stated in in the article, it's dependent on the individual states. It's dependent on the insurers, how they reimburse. There are, at least in our experience, we've been able to get the virtual visits paid for. Okay. It may be that it may be that there are different codes used, and that will be dependent on your own practice, what you decide to do. I don't think there's any across the board answer to this question.
Yeah, it's more complex.
It's pretty complex. Yeah.
Yes. Yeah, and of course it would be, but that's an item. We have a sister publication, Medical Economics, and they have some consultants, weighing in about the the concern and what that means also, even across state lines. I don't know if there's anything that you all do, in such a compact area as New England is, if you do things with patients out of state.
I think that it's discouraged to do video. You can't do video visits out of state
Okay.
because of the reach of your license.
Now, have you found, or have any of your colleagues reported that there is any certain patient demographic that prefers telehealth?
I think younger patients they have such an ease with technology, certainly. And then I think pregnant patients, are keen on it because they want to be careful. And all of our patients that have risks of immunocompromised family members or immunocompromised, like themselves, they really appreciate the ability for this outreach, themselves at risk.
And what about mental health resources? Do you see patients seeking more mental health resources too in this time? Are they seeking that more? Are they more comfortable with it in telehealth?
Yeah, so I think it's a little bit like two questions. So are they seeking it more? I would actually say a lot of patients, I don't know. I mean, I actually don't know the exact numbers behind it, but my impression is that there would be patients who wouldn't know who to reach out to, right? I mean, but if they're already established in care, and just to make a plug, that's the reason for like a virtual well woman visit, right? So that you can assess a patient's need for it. The problem with if you don't actually see these, see the patients for those visits, you might not ever discover those needs. So that's us reaching into them to figure out if they need it. And then, but the patients that are already established with their providers, I think that it is, there's not too much of I think there's not too much lost by going to telehealth to get support and have those visits.
From your perspective, and because I've been reading a little bit like about fibroids and how those surgeries for fibroids might not happen during this period, what have you experienced in your practice, and how can you manage, or have you managed any of those visits? Obviously not the surgical part, we know that, but follow up with telehealth. How has that changed?
Yeah, things like bleeding. So I will say that in the Connecticut experience, the lockdown from, March, April, May, June, we came back at, midway through June. And what we did notice was that the patients who came back, at that point, we didn't have routine. A lot of the routine visits were canceled. A lot of the elective surgery was canceled. Yeah. And we were finding that patients came back and they were a lot sicker. There was more anemia. What we had failed to do was to really get the message across to patients that if they were having symptoms, we would be more than happy to see them, and that we were still there. And I think that this was unprecedented, and getting that message out, that we would still be available to see them. In some cases that wasn't there, or just patients didn't want to show up and felt that they could deal with it. Yeah. I did have many patients though who did make those telehealth visits, and we were able to be very creative to try to help them with things like bleeding and with pain.
I've also heard that people are foregoing, right? They're not being seen for what they normally would be seen for out of fear of going. And then, if any of these surgeries are considered elective, what does that mean for them and their long-term health? So it's really fascinating for me to think about and to talk with experts like you about, the impact you're seeing there.
Well, I think that there's a reframing that has to go on. To like we advocate, we had, when I mean, just what really happened was in that case when we were actually canceling our elective cases and tiering what we thought the urgency of cases were. There was a lot of work by GYNs to say, well, actually, I think someone who's bleeding to anemia, to becoming very anemic is actually urgent. And we need to advocate for this, and we can't control them on medication. So there was a lot of, within the hospital, within the system, we really had to kind of make sure that we were at the table to advocate and just say, because I think there is a tendency for people to think, oh, GYN surgery, it's all elective. And that's sort of us supporting women's health, and sort of saying, actually, they are unable to function. They're in a lot of pain. Pain is not elective, right? So.
Exactly. Yeah. I'll be real interested to see the type of research that comes out from this, this entire experience too, and the studies about any of this that we're talking about. Is there anything that you're working on?
Not with regards to access, although I think it's more, I know that there's going to be a delay. So, I mean, we're looking at different issues on diversity and equity as well.
Research wise? Is that what you mean with the diversity and equity? Because that's a completely the other side of this, right? And that we've talked a lot about on our own editorial staff and with Dr. Spong, our editor-in-chief, about pushing that through. Is there anything that you can say about how you all are addressing that?
Yeah, we actually have a very robust group at Yale. It's a task force that has come out of the events of 2020. Sort of looking at all the different pillars of within like a hospital, and looking at how diversity and equity are viewed there, and trying to really create some actionable items within the clinical realm of how we treat, how patients are treated, about what our hiring practices are like, and how we educate our trainees, our medical students and our residents, nursing students on diversity and equity.
So it sounds like across the board.
Yeah, so I will say there will definitely be more on this. This is, I mean, it's not, I wouldn't call it pure research. It's actually a quality improvement project, right? We're gonna get a baseline understanding and then try to make strides for improvement.